are you seeing now that the supplies are what they need to be?
Yeah.
Yes.
I think it's sporadic. As I talk to my colleagues around the country, certainly there are pockets of areas where PPE is not ideal, but this is an unprecedented time. And the infection control measures that we learned back when we went to school, 1 gown, 1 mask for 1 patient a day or per time, this is a different time. And I've been reusing my N95 mask for a few weeks now. I just broke out a new one to come here just in case I needed to wear it. To answer your question earlier, we're all COVID-19 free. We were all tested, yes. So we're not socially distancing, but we're all negative, and we wouldn't do anything to harm our president, obviously.
Everybody's been tested.
Yeah, we were all tested.
I hope the test works, right?
So we're all tested, we're all negative, and so that's why we're not socially distancing and why we're not wearing masks. Certainly, and I've had several tests throughout this whole COVID-19 crisis. I practice in New Orleans at a community health center. My youngest patient has been 4 days old, a 4-day-old infant. So PPE has been sporadic, but it's been manageable, and we do what we have to do. We're nurses, and we learn to adapt and do whatever the best thing that we can do for our patients to get the job done and get the care provided. And that's what we're going to continue to do as COVID-19 continues.
Sporadic for you, but not sporadic for a lot of other people.
Oh, no, I agree, Mr. President.
Because
absolutely.
I've heard the opposite. I've heard that they are loaded up with gowns now, and initially we had nothing. We had empty cupboards. We had empty shelves. We had nothing because it wasn't put there by the last administration. And I've heard that we have, I just saw it yesterday, where they're making millions of masks a month in a factory from, in that case it was Arizona. It's great. We have other factories being built now for masks. And for the most part, that was fine, but I've heard we have tremendous supply to almost all places. Tremendous supply to a point where we're going to start having some of our supply go to other countries which need it very badly. How did you find that? Did you find a good supply? Huh?
I found that we had what we needed.
Good.
We had to change the way we did things. But
Yeah.
You'll end up being a star.
And Mr. President, I just want to add one thing too. I'm a nursing supervisor where I work at. And one of the blessings I have is my director, my assistant director, his name is Dennis Hunter. He said, you know what, you guys take care of nursing. We'll make sure we have a supply. Mm-hmm. When we all talk about the fears, it makes it so much worse for us nurses to work. We're seeing the reality of it, but to hear it on constantly, there's not enough. In reality, I'm not seeing it. I'm in a hot zone right now. I'm in South New Jersey. We're very close to New York.
And so you don't see that when you hear the
I'm not
stories.
seeing it.
You know why? Because they're fake news, that's why.
I have to say,
I really appreciate you saying that. It's so nice that you stepped up, because they're fake news.
Respectfully, though, sir, at the beginning.
No, when I took over, it's different. Now, I will say this. There was a period of time, but between Russia, and all the stuff that these characters put us through, it's not so easy. And despite that, I've done more than any other president in history in the first 3 years as president. And you can look at that from any way you want to look at it, from rebuilding the military to cutting taxes to getting rid of regulations at a level that nobody's ever come close to saving your Second Amendment, which is under siege, by the way. So, we've done, but I really appreciate your statement. That was really beautiful. And we
the
did.
issue of masks, I remember at the beginning of this crisis that you all are encouraging people not to wear them in order to have it for them.
You're right, but
so
that was
not enough at the beginning.
You're right, Jeff, and the reason that we did such a good job is because we were able, now we have factories all over doing masks and building our own masks and doing them, because a lot of countries, I don't want to be specific, but they sent us masks which were total garbage and they were defective, and they sent us other equipment which was defective. And so now we're building our own masks, we're doing our own masks, we're making them by the millions, and Honeywell in Arizona yesterday was a case in point. And that was some scene. I've never seen anything like it. And I didn't realize, as they put different layers and then they put it together, and each layer has a different function. It's not just like taking a thing and wrapping it, as we said perhaps you can do in certain conditions, but certainly not inside of a hospital. But No, we ended up, we had an empty cupboard, and now we have full cupboards, and we have ventilators, and we have tremendous testing.